Ask the Doctor with Michael Lange begins in 2 minutes. Ask the Doctor with Michael Lange begins in 60 seconds. Ask the Doctor with Michael Lange begins in 30 seconds. Ask the Doctor with Michael Lange begins in 10 seconds.
When it comes to your health, are you seeing the check engine light come on more than normal? It's time to get under the hood. It's time for Ask the Doctor with Dr. Michael Lange. Sponsored by Lange Eye Institute and Fortifeye Vitamins. Dr. Lange is a board-certified optometric physician and certified nutrition specialist, helping people see and feel better through proper nutrition for 25 years. The doctor is in. Call now with your questions at 877-943-9673. That's 877-943-9673. Here's your host, Dr. Michael Lange.
Okay, good morning and welcome to Ask the Doctor. I'm your host, as usual, Dr. Michael Lange of the Lange Eye Institute and Fortifeye Vitamins, here each and every Saturday morning live to answer any and all questions you may have regarding your vision, eye care, or a nutritionally related topic. So, folks, don't be shy. Pick up the phones and give me a call. This is 2 days after Thanksgiving 2019. I am live in the studios. We're broadcasting from Salem Media Studios here in Tampa Bay. We're broadcasting through our regular networks for 2 hours today. So if you're watching me on social media, we're going to be going till 11 o'clock. And social media, you can pick me up right now on Instagram, Twitter, LinkedIn, Facebook, Periscope, YouTube, a variety of social medias. And I see a lot of you are chiming in on social media right now. And of course, you can pick me up on a variety of radio stations as well. Remember, at the end of the hour, you're going to switch your dial, no matter what dial you're on, especially if you're in the Tampa Bay, Sarasota area, to 860 a.m. or to 9:30 a.m. if you're in Sarasota, and they have some affiliate FM stations. But right now, you're picking me up on 97.3 FM The Sky in Gainesville, I think 8:20 a.m. throughout the entire state of Florida, a variety of other affiliates, and live video streaming all over the world. I'm going to give you the phone number for this call-in show. It's 877-943-9673. Write that down. If you have an urge to call me, 877-943-9673. I hope everybody had a great Thanksgiving, didn't eat too much, all right? And now you should start your New Year's resolutions early. You really should. Don't wait till January 1st. And I'm going to help you out, all right? Because we're running the biggest special we have ever run in the history of Fortifeye Vitamins via the internet. And so you got to pay close attention to this. You want to be healthy. Remember, you got to eat the right foods, but you got to take the right supplements. And so Fortifeye Vitamins is the company I developed. All of you that have been listening to me for almost 30 years is aware of this. The website is www.fortifeye.com. Fortifeye is Fortifeye, fortifeye.com. We got distribution centers in Ocala and also in Safety Harbor. But we're running a 40% off deal via the internet. That's right, 40% via the internet. If you go to our website, you got to use the promo code BLACK. So Black Friday special. This is a prolonged Black Friday special. It's going to run until Monday. So use BLACK. You go to fortifeye.com, type in BLACK at the promo code at checkout. Any of the Fortifeye supplements, the new Fortifeye Fit, the new Fortifeye Whey Protein Isolate, the superfood, the omega-3 max, the omega-3, the one-a-day, the macular defense, the enzymes, the probiotics, all of that. And I'm holding up in front of you Fortifeye Advanced Dry Eye Therapy is a big hit for you with dry eyes. All of that's 40% off. I mean, that's a deal. Remember, we ran a special at the Fall Festival that was amazing, okay? Everybody couldn't make it to the Fall Festival, and that's why we're doing this deal. We aren't going to run another deal like this until next fall at the Fall Festival, and we'll probably run a Black Friday special as well. So take advantage of that at fortifeye.com. Use BLACK as the promo code, and you're going to get 40% off. All right, we're loading up on a bunch of callers here. So once again, you're listening to Ask the Doctor. I'm your host, Dr. Michael Lange. I'm a board-certified optometric physician as well as a certified nutritional specialist. We're going to go to the first caller of the morning, who is probably Bob. Bob, good morning. Welcome to the program.
Well, good morning, Dr. Lange. I trust you and your family had a pleasant Thanksgiving also.
Yes, we had a great Thanksgiving. I thank you for that. I hope you did too.
Yes, sir, we did. Dr. Lange, I had an opportunity to talk to Doc Hall earlier last week and inquired of him, and I shall inquire of you also, are there any clinical studies referencing plant sterols and their reduction in cholesterol?
Absolutely. There are some clinical studies. I would not have those handy for you right now, but you could probably Google that. And that now they're not double-blind, placebo-controlled studies with thousands of people in them. They're relatively small nutritional studies, and that's what you're going to see if it's not a big pharma company. But there are some studies that do suggest that plant sterols can indeed help cholesterol. But that's a combination of many things with that, Bob, and we've talked about this before. There isn't a magic pill, all right? And I don't love statin drugs. You've heard me talk about that. I mean, in certain cases, your physician prescribes statin drugs, absolutely. But you got to be careful on just willy-nilly going to a statin drug because your cholesterol is a little high. Depends on the ratio of the HDL and LDL. It depends on the type of cholesterol as well. And it also depends on other blood chemistries, whether your triglycerides are elevated, C-reactive protein is elevated, things of this nature, and even omega index studies now becoming very vogue. And we're going to talk more about that. But plant sterols are something that are natural. It's vegan. You can use to help lower cholesterol. It can help improve prostate health in men. So I think that's an adjunct supplement that you can utilize to help with overall health. But you also have to have exercise, all right, cardiovascular exercise, weight-bearing exercise, sunshine, believe it or not, from vitamin D. If vitamin D levels are low, cholesterol can go crazy. But omega index is something that's huge, and we're going to expand on that. We've talked about that for many years. Having an omega index test is probably very important in your local blood test nowadays because there's so many studies now. Here's an example. There is significant evidence that the DHA component, we've never talked about this on the radio. There's a relatively new study that shows an inverse relationship between coronary atherosclerosis and elevated DHA in the blood. DHA is one of the omega-3s, okay? And so taking a good omega-3 like Super Omega, Super Omega Max may benefit people that have elevated cholesterol. Then also, there's a new study that came out that shows an 18%, Bob, listen to this, an 18% reduced risk of coronary heart disease with a combination of EPA and DHA. It reduces the chance of you having a significant problem with coronary heart disease, especially in the high-risk populations, the ones with elevated LDLs and elevated triglycerides. So a lot of people worry about those numbers, but what you got to do, the reason you worry about those numbers, if cholesterol is elevated, you're concerned about a heart attack or a stroke. So more and more evidence of the correct form of triglyceride form omega-3 in the right levels, and you can't buy that over the counter, quite frankly, so is proving it reduces the chance of you having the significant problems related to the elevated cholesterol. And we're finding more and more about diet. Diet isn't linked to cholesterol as much as we used to think. So people can eat meats, eggs, red meat, and things like that, and it really doesn't make a big dent on the cholesterol as much as we thought. But diet is important. So the combination of diet, exercise, sunshine, hydration, taking your omega-3, and certainly you can add plant sterols. And I can link you up to some of those studies later. But all of that is, responsible for you being in that anti-aging zone.
Yes, and aren't we all acquiring that zone?
Yes, the sun is important. It's hard to acquire. You're getting you must be on the cell phone out in the shed today. I'm not getting a really good pickup.
I'm sorry, but I'm always on my cell phone because I'm working on Saturday, so I'm in the car.
Okay, I got you. All right, Bob.
Okay, Dr. Lang.
You have a great day.
Thank you, sir. So much to talk to you. Talk to you soon.
Bye-bye. All right, Bob's been a caller, as most of you know, for eons. Bob's usually the first caller of the morning. Last week he wasn't. He was the third caller. We had a lot of people ahead of him. All right. So before we go to the next call, I just want to mention the importance of taking a triglyceride form omega-3. Remember, most omega-3 that you buy over the counter is an ethyl ester molecule. That means it has ethanol attached to the backbone. Ethanol ain't good. It goes in your race car. It shouldn't go in your gut. And so that's very inefficient. It has to go through your liver and cleave off the ethanol and replace the triglyceride backbone before it absorbs into the bloodstream. So we know now, remember, an 18% reduced risk of coronary heart disease if you're taking a good omega-3 that's high in EPA and DHA. So there's some prescription fish oil companies out there that are just pushing EPA, all right? Well, another study came out showing that it's the DHA, not the EPA, that had a significant inverse association with coronary atherosclerosis. That means the CAC, the coronary artery calcification score, actually went down. All right, we're going back to the phones. I think we got Steve in Bradenton. Steve, good morning. Thanks for holding.
Good morning, sir. How we doing?
Fabulous. It's a great 2 days after Thanksgiving.
Yeah, it's a beautiful thing. Along Bob's lines there's a product called garlic. Is that any good for cholesterol?
Yep, there's some evidence about garlic also helping with cholesterol. And I think that's a good natural approach, absolutely, especially if it's the deodorized form. But some people are suggesting that the regular form of garlic may be better, the stinky form. Also, niacin. Niacin is a very good form of natural approach to helping cholesterol ratios, although it does make you get red. It makes you feel a little weird. It makes you flush, and you have to get the type that causes flush. You don't get the no flush. You get the type that causes flush. So there we go. We got plant sterols. We got garlic. We've got omega-3, and we've got niacin combined with exercise, proper diet, sunshine, and who knows what happens to your cholesterol. Maybe you don't have to get on that statin drug.
I've never had any problem with it. Mine's always within the bounds, and I've never had to do anything with it,
Good.
My main question I was calling about was being diabetic, and the last time I saw Dr. Snyder, he lasered up some of the leaking capillaries in the back of my eye, and he says it would take like 6 weeks for it to actually set up, I guess.
Mm-hmm.
Does that improve your eyesight when they do that, or is it just something you do as a thing you do?
Well, indirectly it improves your eyesight because it stops the bleeding that causes, visual devastation because of retinal damage. So with diabetics, you develop these little irregular blood vessels, neovascularization, and these blood vessels leak profusely and cause swelling of your retina, especially in your macula. When that happens, your vision drops significantly. So specific lasers are used to basically seal off those leaky microaneurysms to help stop the bleeding. combined with injections of anti-VEGF medications, things like Avastin, Lucentis, Eylea, and there's some other newer generation medications they can inject as well. So, the whole goal behind the retina specialists do the minimal amount of lasers as possible, but obviously lasers are beneficial in many cases and are necessary treatments.
How important is the micron reading when you do the OCT scan?
Well, that gives the doctor a means of analysis for progression, so they can see if the retina is actually getting thinner, if it's getting thicker, more swelling, less swelling. So it's a very good diagnostic tool. That's the advent of the OCT that allows us to do that. So OCT technology is amazing. Many doctors are doing the OCTs much more frequently and not as much on the fluorescein angiograms anymore, because that's a more invasive test where they inject the dye into your system. But that's also a very beneficial diagnostic tool. So the combination of the fluorescein angiograms and the OCT technology is very useful, especially in patients with diabetic disease.
Theoretically, if you keep your blood sugar at good levels, you shouldn't have the bleeders, or are they going to bleed anyway?
Well, it depends on if you've always had your blood sugar at good levels. So if you always had good blood sugar levels, then in theory, you're not going to get diabetic retinopathy. You're not going to be a diabetic, okay? But being a diabetic, that means that your blood sugar has been elevated at one time. It's been out of control. And a lot of that damage occurred years ago, and it's weakened, the whole retina and the vascular system. And so many diabetics, even with blood sugar under control, still get some leakage of the blood vessels. You also have to know you have to control your blood pressure as well, because you think of, the arteries and veins like old, weakened, rotten garden hose. And if that pressure in that garden hose is elevated, it's going to start to break and squirt in the yard. Think of that with your blood vessels in your eye. If your blood pressure is high, then you're going to have more leakage. So we got to have normal blood pressure or even low blood pressure along with low blood sugar or normal blood sugar.
I think I'm what you call maybe a borderline diabetic, because my blood sugar, it might go to like 140 in the morning, and I take 2.5 gram glipizide, and hell, it goes down to like 84 within about 3 hours.
Right.
So
right.
I don't think it's real. I don't think it's real bad, And I've even gone days that never went over 150 even in the morning, and then it goes down during the day. It'll go down to like maybe 120.
Right. So it sounds like you've got a good handle on your blood sugar, Steve, but you've been practicing the things that we've been preaching on the show for many years now.
Yeah.
And,
yeah.
The big thing was getting your weight under control, because at one time you didn't have your weight under great control, and you do now.
Right.
So you're doing everything you can possibly. You're seeing great doctors. You're listening to the show. You're practicing good dietary habits. You're doing everything. And then, good Lord willing, you're going to stabilize and not get any worse. So keep on doing what you're doing, and a little prayer ain't going to hurt either.
That's right. I called Danny over at the Vitamin Center the other day to get some more Focus ordered. Mm-hmm. And Doc Hall answered the phone, and we had a nice conversation.
Good. Doc Hall is a wealth of knowledge. He's an icon in the nutrition industry, especially in the bodybuilding industry and the powerlifting industry. But he's a wealth of knowledge, and we're real happy to have Doc Hall on the team at the Lange Nutrition Center and Fortifeye Vitamins.
And he's a very entertaining type guy, too. I'm sure you know that.
Oh, yeah, that he is. And
if
Doc Hall is listening, he'll get a kick out of this. Yellow Submarine. All right. He's laughing right now. It's an inside joke.
Okay. Thank you, Dr. Lange.
All right, Steve. Have a good day. Bye-bye.
You too. Bye.
All right. You're listening to Ask the Doctor. I'm your host, Dr. Michael Lange. The phone number is 877-943-9673. That's 877-943-9673. You can call no matter where you are, social media. You're welcome to call and ask me a question. One more time, 877-943-9673. Remember, Fortifeye Vitamins is running their Black Friday extended sale, 40% off. All of you are going to take advantage of this because this is the best deal you're ever going to get until next year on next Black Friday. Go to fortifeye.com, Fortifeye, fortifeye.com, and put the promo code BLACK under promo code at checkout, and you're going to automatically get 40% off whatever you order. We've got whey protein concentrates from New Zealand. We've got whey protein isolates from America, all grass-fed. The Fortifeye Fit, it's a pre-workout, post-workout drink we came out with about a month ago now. We got our organic blue-green superfood. The omega-3 is our number one seller. The Fortifeye Super Omega 3 Max is 50% more potent than our Super Omega. But we also have enzymes and probiotics. Fortifeye Focus, for all of you that are watching me on social media right now, you should be taking the little pill called Fortifeye Focus. It's a combination of lutein, zeaxanthin, and astaxanthin. The lutein and zeaxanthin helps filter out the harmful blue light that you're getting from the computer, the iPhone, and the iPad right now. And then the astaxanthin improves focusing ability, reducing accommodative stress, so your eyes focus better and they're more relaxed. So it's a triple whammy against computer vision syndrome. It's called Fortifeye Focus. It's usually, $28, $26, something like that, and you're going to get 40% off all of that. So take advantage of it. All right, we're going back to the phones. I think we've got another Steve in Clearwater on hold. Steve, thanks for holding. Good morning.
Good morning. I was wondering, you were talking to the other Steve about leaky capillaries and all that, and the anti-VEGF medicines that they inject in the eye and stuff.
Right.
Well, I'm just wondering that it seems to me vascularization would be good because it would increase the nutrient delivery to the cells, but the problem is actually with leaky vascularization. So why does doctors worry about vascularization? Why don't they concentrate on whether that vascularization is good or bad? Do you follow what I'm saying?
Absolutely, and that happens in the heart all the time. People have blocked arteries and they have collaterals that build up and help the heart.
Yeah.
But the problem, Steve, in the eye, these irregular blood vessels are so fragile. They're very thin, they're very fragile, and they break and they leak. It doesn't matter if you have diabetes. They're just very small, very irregular, very fragile, and they break. When they leak, all right, the retina is the only place this happens. Then you have macular edema and you have visual devastation. So we do not want irregular blood vessels any part of the eye. We get that also with contact lens wearers in the cornea. The cornea is an avascular zone. That means there's no blood vessels in the cornea. If you wear a contact lens, it's a little bit too long. You see, you can't lie to the eye doctor. When the young kid comes in and says, I take those contacts out every night. And I look at his eye and say, when's the last time you took those contacts out? I mean, because he's got these irregular blood vessels growing into the cornea, and that's very bad. It causes some serious problems to the cornea, scar tissue and things like this. So we don't want irregular blood vessels in the cornea. We probably want it in the heart, all right, so we don't die. But we can go blind from these irregular blood vessels in the eye. Now, if there was a way to strengthen those blood vessels, and certain foods can help this. They have anti-VEGF activity, but certain foods actually strengthen the capillaries so they don't break. Carotenoids like lutein, zeaxanthin, and astaxanthin do that. And then things that have anti-VEGF effect are zeaxanthin, astaxanthin, resveratrol, which comes from red wine, green tea polyphenols, all right? These also have anti-VEGF effect. But, if you listened to the show last week, I'm not as big an advocate of green tea anymore because of the oxalates that are in it. So, you're kind of damned if you do, you're damned if you don't. Green tea has polyphenols that are good for you, but also is very high in oxalates that can cause kidney stones. And all you got to do, Steve, is have one kidney stone, and you don't want to touch any food with oxalates.
No, it does. Just like my personal case, a personal morbidity leads to personal scholarship very quickly. You were talking about, those kids can't lie to you.
Right.
I had an emergency room physician. He says he has a personal rule. If he's asking a person if they do something bad, and whatever they report, you double it. And then if he's asking if you do something good, whatever they report, you half it.
I like that.
So anyway, and one more thing. Mm-hmm. Would it be helpful if before you had laser treatments, you took like antioxidants, because those lasers would knock electrons off of all those molecules in your eyes, and you have a free radical burst from the laser. Do you follow what I'm saying?
Yes. I think.
So right before you have the laser treatments, you take a dose of antioxidants. I don't know if it would make any difference or not, but
I think that's a good idea to help control free radical damage in the eye and help control post-surgical inflammation. Absolutely.
Yeah.
I think that's a very good idea. And I think there's some very minimal studies, pilot studies, that suggest that patients that have higher antioxidant levels, higher ORAC value, and something, I can't even think of that number. I'm thinking in the blood when we do a Spectrox number. And patients that even have higher omega indexes, that they tend to heal a little bit faster post-surgically. So the doctor's going to want to take you off all vitamins and all omega-3 prior to surgery, but they can take it up to it, and then 5 days before you can stop taking it because they're concerned about any potential blood-thinning properties that vitamins may have.
Yeah.
So, yeah.
Pretty cool.
Yep.
Okay, well, thank you, and I'm so glad you got this new program, too. It's really going to be good for you.
I think so, too, Steve. Thanks for the call.
Okay.
All
bye.
right. Bye-bye. And hopefully Steve will listen in for the next hour, and all of you will listen in for the next hour, because after this hour, you're going to switch the dial to 8:60 a.m. if you're in the Tampa Bay, Clearwater area, and you're going to switch it to 9:30 a.m. if you're in Sarasota. And all of you watching on social media, we're still going to be live on social media. All right, let me give you the phone number for Fortifeye Vitamins. Write this number down. We're based out of Ocala, Florida. This also goes to our Lange Nutrition Center because one of our distribution headquarters is inside. We have a warehouse inside Fortifeye Vitamins. I mean, we've got a building that's about 14,000 square feet that houses the Lange Nutrition Center and our distribution center in Ocala. The phone number is 866-503-9746. One more time, get a pen. If you'd like to call Fortifeye Vitamins on Monday morning, you can talk directly to Doc Hall. He's there. Certainly, Danny is helping to run a smooth sailing shift. Miss Nita's there every now and then. The number for Fortifeye Vitamins is 866-503-9746. And we'll still run this 40% off until Monday for those of you that do not have internet access. There's a lot of you that don't, all right? So you can call that toll-free number and order it. So we're still going to run it 40%. I got to let everybody know at Fortifeye that we're doing that because hopefully Dr. Hall is listening, because I was stopping it Sunday at midnight. But we're going to run it a little bit longer. So one more time, Fortifeye phone number is 866-503-9746. Go to the website at fortifeye.com, www.fortifeye. I'm an eye doctor, so it's kind of a play on words. Fortifeye.com. Remember, promo code, I'm blowing it out, BLACK. 40% off all products. You should be loading up a year's supply. All right, we're going to go back to the phones. We're getting inundated. I think it's Ram in Tampa. Good morning, Ram.
Hey, good morning, Doctor. How are you doing today?
Fabulous. And yourself?
Higher than gold. No complaints here.
Awesome.
I have a very complex question, and probably for you it's very simple.
All right.
I had a retinal detachment. Everything went fine. And then the after call, the follow-up, he's looking at it, and he says, now I have miniature cholesterol balls, if you want to call them.
Mm-hmm.
And, of course, he's not happy about it, so he's going to be sending me for a lot of tests.
Right.
All my cholesterol tests, like in the first of the year and before the operation, they were perfect.
Mm-hmm.
So hopefully you can expand on this and tell me a little bit more about it.
Right.
You will be so kind.
So that's probably what he saw was something called a Hollenhurst plaque. And this is where we actually see little plaques in your arteries, usually at the bifurcation of a venial and an arterial. We see these little plaques, and that isn't necessarily a good thing, okay? But the key is early detection. So if they detect that, they can make sure that you do not have the risk factors associated with dropping dead from a stroke or a heart attack, all right? But that tells me, remember, the eye is the window to the body. So your optometrist or your ophthalmologist can often help detect a pending health problem, and that's what they've done. They've detected this plaque, and this makes you become proactive at what you can do. And so here's the problem. A lot of doctors will find out, oh, you got a plaque in there, and they document it in the record, but they never do anything about it. At least he referred you out. Usually to a primary care physician, internal medicine doctor, or better yet, a cardiologist is a good idea. But this would definitely tell me you need to be taking Fortifeye Super Omega 3 Max 2 per day, unequivocally, without a doubt, no matter what anybody says, all right? Because the new studies I started this show off talking about an 18% reduced risk of coronary heart disease, and also the DHA is almost 1,000 in this. The new studies show that it reduces coronary atherosclerosis. And that's what you have going on there. You've got some atherosclerosis. It could have been some plaque that, broke off of your aorta or broke off of your carotid arteries and it lodged in your eye. Do you smoke?
No, sir, I do not.
Good. So don't start smoking. And are you doing much cardiovascular exercise?
That's the funny part. I've for the last probably 20 years, I've been taking all the products, not yours specifically,
right,
but very similar. And yes, I'm a very active person. I do walk every day and lift weights, even though I'm 64. But first time I ever had this before.
64 is young. And so
I understand that.
I would also make sure you're getting plenty of vitamin D, because low vitamin D can be associated with this as well. So I think you're under good hands. They made the appropriate referral. If you're not taking Fortifeye Super Omega 3 Max, go to the website at fortifeye.com. Look at those studies. They're right beneath the Fortifeye Super Omega 3 Max. And those are the levels. Those are 50% higher than my Super Omega that we've had out for almost 10 years. That's global. Doctors all over the world are recommending it. It is the highest EPA and DHA and 2 gel caps in the United States right now. It has 1,200 EPA, 900 DHA in the triglyceride molecule. And I don't know if your doctor has you on a baby aspirin. I don't want to recommend that, but you can talk to your doctor about baby aspirins. Now, the problem with baby aspirin, if you do start a baby aspirin, you got to keep staying on it because you can get a rebound effect if you stop it, and that's not good. But there's some evidence that even low-dose baby aspirin. So I take a half a baby aspirin with my fish oil at bedtime. And the reason I do that is because there's some studies that indicate the aspirin potentiates something called resolvins and protectins that are in the omega-3. Actually, they work synergistically together at reducing any inflammatory plaques and things like that in your body. But talk to your doctor about that. I don't know your history, so I don't want to make that recommendation. Just ask your doctor if you can do that, if you're not already, all right?
Actually, he recommended that, and I started taking it, as you have recommended previously, with the fish oil at night.
Good.
Yes, I'm doing that right now. Yes, sir.
Perfect. And then what you want to do is go back to that doctor about 6 months down the road and see if that plaque has gone away, because sometimes it actually goes through and it goes away and it vanishes. And if that's the case, then you're in that anti-aging zone. You want to make sure that you don't have more plaque building up. If you do, then they got to find out the reason for that. But that's why I would like you on that omega-3, because it reduces coronary artery calcification, and there's some new studies that indicate that.
Great. Okay, well, thank you so much for your time, and I appreciate your program. It's very, very helpful.
All right, Ram, you take care. Bye-bye.
Have a great weekend, sir. Bye-bye.
All right, you're listening to Ask the Doctor at 877-943-9673. That's 877-943-9673. I do want to mention we've got a new product at the Lange Eye Institute that all my staff is being trained on right now. It's called iLux, and iLux is for meibomian gland dysfunction. It's here's a little brochure I'm holding up in front of everybody. Real dry eye relief can be yours. Experience relief from symptoms such as dryness, irritation caused by meibomian gland dysfunction. So you can take all of our supplements. You can take the Fortifeye Advanced Dry Eye Therapy. It helps. You can do hot compresses with the Brooder mask. That helps melt this stuff that's clogged in there. But this is a device that actually heats up your meibomian glands and then squeezes the meibomian glands and pulls all the material, the meibum, that's like thick cottage cheese in there, out. So it empties the meibomian glands, therefore allowing you to secrete a healthier tear film. So what we do, we clean them out with this technology, and then you stay on the Fortifeye Advanced Dry Eye Therapy, which is a combination of our omega-3, our Fortifeye Focus, and black currant seed oil. That combination keeps them open, and you still do some hot compresses. So this is called iLux Meibomian Gland Treatment System. We're one of the first in the area, one of the first in the country to have it. It just came out and was approved less than a year ago. A lot of other technology exists that's even more expensive. This is $5.99 to do it. An example is something called LipiFlow is a good procedure, but LipiFlow is costing anywhere from $900 to $1,500. And the thing I like about this over the LipiFlow, it actually allows us to see the meibomian gland evacuation. We see this meibum flowing out of the meibomian gland, so we know it's working. Now, the problem with it is most doctors will say, well, we don't want that because with LipiFlow, we just insert this into their eye and we could leave the room for 15 minutes. This is got to have somebody that's trained doing it. And so most doctors want something that's a little simpler. And so this is called iLux. We have it available at the Lange Eye Institute. Remember, it's not covered by Medicare, but if you have chronic dry eyes, meibomian gland dysfunction, you have this done, and the studies indicate it lasts for about 2 years. So you're going to get dramatic relief. Now, I think it's going to last a lot longer than 2 years for our patients because we're educating our patients and putting them on the right supplement, that being Fortifeye Advanced Dry Eye Therapy. And so I think it's going to keep the glands open a lot longer. But we'll know for sure once we start doing a lot of these. All right, we got a few people loading up. I think the next caller might be Mike in Gainesville. He's been waiting patiently. Mike, thanks for holding. Good morning.
Good morning, Doctor. I have 2 questions. Number one, I heard you talking about keeping the contacts in. I have the kind you can wear for a month, but I always take them out every 2 or 3 days. I have a problem with my right arm, so I put them in with one hand, so it's a pain in the neck. Is that okay to keep them in for 2, 3, 4 days and then clean them?
Absolutely, depending on your corneal health. So you're either in one of 2 lenses. There's only 2 lenses approved by the FDA for 30 days of continuous wear. I actually did the clinical studies for this material back in 98 to 2002, and that's called Alcon Night and Day or Bausch & Lomb Pure Vision, all right? And really the only one that's being sold right now is the Alcon Night and Day. It used to be called Ciba Night and Day. So that's probably the lens you're in. If you're not in that lens, it's not a 30-day continuous wear lens. That's the only one available. Now, there's others that are available that are FDA approved for 1 week of continuous wear. And so it's based on each individual. If it's convenient because you only have one hand, then obviously convenience is important, all right? As long as your eyes aren't too dry, because remember, when you're sleeping in a contact lens, it does increase your risk of an eye infection. Now, I got to tell you, in the clinical studies that I had, we had patients in lenses for 4 years, and they had to leave those lenses in for a month, take it out, throw it away, put a new one on their eye after leaving it out one night for a month. I didn't have one infection over a 4-year period in those clinical studies. So it's good material. It's not for everybody. It is safer if you take it out. But like you said, you're taking them out every 3rd or 4th day. I think you're probably going to be fine. Use a good lubricating eye drop. When you wake up in the morning, put something like Blink Tears, the preservative-free version, in your eye right when you wake up because they're going to be very dry. Drink plenty of water during the day, and consider taking a good triglyceride form omega-3 like our Super Omega or our Super Omega Max. And if you're going to do that, take advantage of the Black Friday special where you're getting 40% off.
Yeah, I'm going to do that on, I called you last week. I'm the guy 72, and I think I have scarpenia. You know, I want to put muscle mass on.
Right.
So you said Fortifeye Fit would be good. I was about to order it, but I also have a kidney transplant. And would that affect any of the anti-rejection medicine?
Well, the Fortifeye Fit should not. It's actually may even be beneficial. The Fortifeye Fit does not have high levels of protein. It only has 5 grams, okay? But it's got some other things in it that are very good. I think you're going to be fine with that. I mean, you can always talk to your doctor about that to see what they say. But this is all whole food derivatives, so it's very healthy. And you want to be very careful about super high dosages of protein if you have kidney issues, okay? So you don't want to be taking, 50 grams of a protein powder 5 times a day.
Right. Well, then I'm going to order a Fortifeye Fit. I think I'll talk to my doctor, but it seems like it would give me more muscle mass.
Oh,
correct?
Absolutely, because sarcopenia is something muscle wasting as we get older, and it will definitely, I guarantee, that's my coon-ass accent coming out, I guarantee it will help. Now, let me find, if you buy this and your doctor says don't take it, then I'm going to give you your money back. I'm not going to stick you with anything, okay? So you're not going to lose out.
And it's 40% off this weekend, right?
It's 40% off if you order on the website and use BLACK as the promo code, BLACK.
Okay.
All right.
Thank you very much, Doctor. You've been very helpful.
All right. Mike, you take care. Bye-bye.
Take care. Bye.
All right. We got a lot of great callers. I hope some of you, it's hard to talk, tune in for the next hour. Remember, it's only going to be our second time live on the Salem Media radio station, so we want to make sure we get some calls. I don't want to look silly. I could talk for an hour, however. So remember, After the show, we're going to talk a lot more about some pretty cool stuff. You're going to take the dial from 8:20 a.m. and switch it to 8:60 a.m. if you want to hear me. And if you're in Sarasota, you're going to go from 8:20 to 9:30 a.m. If you're at 97.3 FM The Sky, wow, you're just going to have to tune in on one of the social medias. Go to any of my Facebook page, Instagram. Facebook's probably the best thing to go to. You can go to either Michael Lang Facebook, Michael Lang OD Facebook, Dr. Michael Lang Facebook, Lange Eye Institute Facebook, Fortifeye Vitamins Facebook, Lange Nutrition Center Facebook. So we're on a variety of Facebooks, let's put it that way. All right, let me give you the phone lines before we go to the next call. 877-943-9673. That's 877-943-9673. I am holding up the Fortifeye Fit. I got to tell you guys, this barrel or this container's too big. When you order this, you'll notice that it's only filled up like 25% of the way. The next shipment is going to be much smaller. It's going to look like it's totally full. The scooper in here has a line on it. Only fill the scoop up to the line and you get 20 servings. Remember, for somebody that's really into working out, you're a power lifter, you're a weightlifter, you're an athlete, or you just want to get in shape faster, you take this pre-workout and post-workout. Pre-workout and post-workout. It has no stimulants in it, so it's safe for you if you're getting up there in age. You don't want to trigger atrial fibrillation or heart arrhythmias. This is a combination of collagen protein for our ligaments, tendons, and joints, micronized creatine monohydrate for our muscles and for our brain, believe it or not, L-glutamine for our muscles and for our gut, D-ribose gives you clean energy. It supports mitochondrial health, ATP production. L-citrulline, it gives you that pump when you're in the gym, making your biceps look bigger, funneling the amino acids and the protein to your muscle, so for recovery, it works much faster. We have cluster dextrin. Cluster dextrin is something you're never going to see when you buy anything over the counter, a sports nutrition supplement. That's highly branched cyclic dextrin. It is literally the carbohydrate of the future. It's kind of like a low glycemic, high glycemic index carbohydrate combined. It gives you explosive energy. So if you're on the New Orleans Saints or the Tampa Bay front line, it gives you explosive energy. If you're an Ironman competitor, it gives you prolonged energy. What could be better in the gym? You're doing bench press and you're in the gym for an hour or two. So it is the best carbohydrate that has zero sugar in it, okay? And it's shaped, the cell is shaped like a bulldozer, so it pushes more amino acids and more protein to your muscle, making you grow faster. You have to have carbohydrates in the drink post-recovery in order to replenish muscle glycogen and to push the amino acids and the protein to your muscle. If you're on a low carb, a low sugar, something with sucralose, aspartame, unnatural flavors, I think it does more harm than good. It also has velocitol. Velocitol is amylopectin chromium complex made by Nutrition 21. Amazing. It actually doubles the power of the protein and the amino acids. Branched chain amino acids in the right ratio, 2:1:1. We've got 4,000 additional milligrams per scoop. And then astaryl astaxanthin. You've heard me talk about that. Not only is it good for your eyes, but it's amazing for muscle recovery and muscle endurance. That's all in the Fortifeye Fit. You can use that from 13 years of age to 100 years of age. My 13-year-old daughter's on it. My 92-year-old mom's on it. I'm on it. I'm having the best workouts of my life. I've told you this before. I'm 58. I'm as strong as I was when I'm 30. Actually, my bench press is stronger than it was when I was 30 now. You'd be amazed how much the strength has improved in 7 to 8 months on this. I developed it for a lot of the elderly senior population. I just developed it a little too late for my dad. Most of you know my dad fell, hit his head, and died in February. I miss Dad. But I've got it for my mom. And so what it does, you don't even have to work out. You take 1 scoop a day. It's going to help increase your strength so you don't fall. And God forbid if you do fall, it can help reduce the chance of you having a traumatic brain injury or having a concussion and having brain problems from that. So all pro athletes should be taking this. Anybody that's a boxer or a football player, because the creatine has been shown to reduce the chance of a concussion. Everybody should be on it that's an athlete like that. It's almost malpractice if you're not on it. All right, we're going back to the phones. We're getting loaded up. Let's go to Steve in Tampa.
Hey, doctor. Hope you're having a great holiday. You mentioned AFib. I've cured two older relatives of AFib just by getting into what they take every day. One was green tea. The other one was a couple of supplements, and got them off of those and the AFib, but their doctors never mentioned that the stimulant could be the problem. They went right to a beta blocker with both of them. So
There you go. Huh.
hey, is SpectraCell still the gold standard in blood testing?
I love SpectraCell. I really do. It's a great way to checking intracellular absorption of nutrients. It's just that a lot of doctors aren't in tune with it. They don't know about it, and it's getting relatively expensive. It used to be covered almost completely by Medicare or your insurance, and there's a time period where it wasn't covered at all. But from my here lately, it is starting to be covered again, and if it is covered, then I'll start doing it again. Because, I can't ask somebody to pay $1,500 for a blood test. Even $500 is expensive. But I think, from what I hear, it may be covered. So that's something you can talk to your doctor about.
Here's an eye question. I fasted for 3 days and had a lot of white discharge out of the eyes. That's just toxins coming out of the body, right?
Yeah. When you say you fasted for 3 days, did you fast with no food at all?
No, nothing, just water.
Oh, wow. Okay. And you did okay?
Yeah, I was, the thing is I had inadvertently or whatever got busy, and it was 24 hours I hadn't eaten, and I thought, you know what? I might as well, it's a great start on a 2 or 3 day detox.
Sure.
So this is what we call sleep in the eyes. What exactly is that?
Well, sleep in the eyes when your meibomian glands, once again, I talked earlier in the show about meibomian gland dysfunction. And most of that goop that's coming out is from your meibomian glands. They've probably been a little bit compromised, and it could be related to your diet, being on the detox mode. Maybe it's helping the meibomian glands clear. It's possible. Or you could just have what we call blepharitis. It's an accumulation of bacteria on your eyelashes. So what we do is clean the eyelashes before we go to bed, put a hot compress on. That makes the goo come out so that it's a clear olive oil that's coming out instead of this pasty white stuff. So that tells me that, number one, I'm sure you're taking your omega-3. Keep taking your omega-3. Clean your eyelashes right before you go to bed. Either take a shower, let the hot water hit your eyes for about 4 minutes and clean them really good with a washcloth, or put a hot compress on and then clean them with baby shampoo or something called OcuSoft foam right before you go to bed. It's kind of like you brush your teeth. We do that before we go to bed, but we don't clean our eyelashes before we go to bed. Remember, believe it or not, our eyelashes are one of the dirtiest parts of our body. They have bacteria, they have viruses, they have antigens, and they have mites, something called Demodex, that hangs out on the eyelashes and then crawls in the glands and lays eggs at night. And so we got to clean the lashes before we go to bed, and I bet you won't have that problem. So I don't know if it's ironic that you had it on the fast or if it's just going to happen anyway.
A quick question about the aspirin. If you're taking blueberries, not taking, but eating blueberries on a daily basis, do you think aspirin would just not be necessary?
No, I think it depends on each individual, okay? It depends on your risk factors. If you're in good shape and, your blood chemistries are normal, why add a drug to the mix, okay?
Last time I cut myself, my blood looked almost like plastic. It was so bright and red. It was not even that deep, gooey red. It was more of like a watery. So I got my, between the garlic every day and the blueberries, I'm right there.
And so,
I want
Steve,
to mention the clean air. We had talked about that before, and my family and I are really on a quest someplace to find clean air near where we live, where we can build a small place within, an hour's drive from here. I'm serious, where we can get some clean air, because it is almost impossible to find clean air in the Tampa Bay area.
You got to go further than an hour away. I mean, I lived in Ocala for many years, and the air is pretty clean in there, but you really got to get up to the mountains. North Georgia is probably the cleanest air and the closest place. I mean, North Georgia takes you about 5 hours, North Carolina.
I can't get all that. You know how it is getting the kids and everybody for 5 hours. I mean,
right.
We'll keep driving around.
Yeah,
all
you
right,
can
doctor,
go out
thank you very much. And
go out to the Ocala National Forest. A lot of shrubs, a lot of vegetation, so producing a lot of good oxygen. That's probably a good place to go. And that's, Ocala, it's not that far from here.
Well, we have a boat, and believe it or not, when I'm out there and you hit where the curvature, and you can see all that smoke and stuff sitting out on the Gulf of Mexico. It's pretty sad, but clean air, the basic things, and I think we're overlooking that. Can you mention real quick about the sale again, where we can find those items and so forth? It's all on your website?
Absolutely. Yeah, go to fortifeye.com, Fortifeye, our website, and then use the promo code BLACK. And you'll get...
Every time I give somebody your website name, I can't find it. So
Yep. And
maybe they should have drlang.com or something where you can, the Fortifeye thing gets to my thing.
Well, you can go to a new website, drmichaellangracing.com, drmichaellangracing.com, and then go to sponsors, and you'll see Fortifeye Vitamins. You click on it, it goes right to my website, to the Fortifeye website.
Gotcha. Thank you very much, Doctor.
All right, take care. Bye-bye. All right, we got time for one more call before we go to the break. Remember, you're going to go to 8:60 a.m. after the break and 9:30 a.m. if you're Sarasota. Just switch the dial or watch me. If you're on 97.3 FM, go to my Facebook page or any of the other areas. Or you can go to The Answer, 8:60 a.m. The Answer, and go to their live site where you can listen to the radio station. All right, let's go to Ron in Beverly Hills. We're going to have to talk fast. Ron, we got 1 minute.
Okay, real quick. I woke up, it was Thanksgiving morning, and I had like a little black, looked like a cobweb, and I moved my eye, and it's like a little cobweb bouncing around.
Mm-hmm.
I tried to call, to set up an appointment to go see a doctor the following day, but everybody was closed after Thanksgiving. Is this something I got to really get real quick, or...
Well, I would get in to see somebody. That's probably what we call a posterior vitreal detachment. It means you have a floater, and the gel has pulled loose from the back of your retina. It happens to everybody sooner or later. If you didn't have flashing lights with this or thousands of floaters, it's probably benign and nothing to be concerned about. However, and this is a big however, sometimes you can have a retinal tear or retinal detachment. So if we don't look at it, we don't know for sure. So there's eye doctors that are open today and Saturday you can go to. You got to have your eyes dilated just to make sure it's not a retinal tear. So go get your eyes dilated, okay?
Okay, and what's the best?
We're out of time, Ron. We're out of time. Tune in for the next hour of Ask the Doctor.
All right, thanks a lot. Bye-bye.
All right, I want to thank everybody for tuning and listening to Ask the Doctor. Remember, we got another hour coming up in about 5 minutes.
There's nothing more frustrating and irritating than chronic dry eye. It never stops. The itching, the scratching feeling, the fatigue and weariness. If you're suffering from chronic dry eye, go to Fortifeye.com and join thousands who've discovered Fortifeye Advanced Dry Eye Therapy, a combination of Fortifeye Super Omega, Fortifeye Focus, and Fortifeye Black Currant Oil GLA. Fortifeye Advanced Dry Eye Therapy works to address oxidation and inflammation in the eye and the entire body. This combination, once only available to patients in the doctor's office, has now become available to you. And already, countless numbers of listeners have found relief with Fortifeye Advanced Dry Eye Therapy. If you or someone you care about struggles with dry, itchy, exhausted eyes, order Fortifeye Advanced Dry Eye Therapy today at Fortifeye.com. That's FORTIFEYE.com, or call 866-503-9746. That's 866-503-9746 and at Fortifeye.com.
While others are hitting happy hour, you're hitting the gym. While they're hoisting mugs, you're lifting kettlebells. You owe it to yourself to get the most out of your fitness regimen before and after your workout with Fortifeye Fit. Fortifeye Fit's power-packed formula is designed to enhance muscle synthesis, strength, and endurance. All evidence-based nutrients in this proprietary formula are well documented and backed in good clinical studies. Taken before and after your workout, Fortifeye Fit is also hailed for what it doesn't contain. No dyes, artificial flavors, or carrageenan. With Fortifeye Fit, you get all you need to get the most out of your workout without needless additives and sketchy sweeteners. Order Fortifeye Fit today at Fortifeye.com. That's FORTIFEYE.com, or call 866-503-9746. That's 866-503-9746. 866-503-9746. And at Fortifeye.com.
it comes to your health, are you seeing the check engine light come on more than normal? It's time to get under the hood. It's time for Ask the Doctor with Dr. Michael Lange. Sponsored by Lange Eye Institute and Fortifeye Vitamins. Dr. Lange is a board-certified optometric physician and certified nutrition specialist, helping people see and feel better through proper nutrition for 25 years. The doctor is in. Call now with your questions at 877-943-9673. That's 877-943-9673. Here's your host, Dr. Michael Lange.
Okay, good morning and welcome to Ask the Doctor. I'm your host, Dr. Michael Lange of the Lange Eye Institute and Fortifeye Vitamins, here each and every Saturday morning live to answer any and all questions you have regarding your vision and eye care. So take advantage of this hour. Don't be shy. Pick up the phones and give me a call. If you're new to the program, who's Dr. Lange? Well, I'm a board-certified optometric physician. I'm also a certified nutritional specialist. I'm the founder of Lange Eye Care and Associates and the Lange Eye Institute. I'm also the founder of Fortifeye Vitamins. And I started hosting Ask the Doctor March 15th of 1993. That's a few years ago, on multiple radio stations throughout the great country and live video streaming all over the world. So I've been hosting Ask the Doctor for getting close to 30 years. So this is a live call-in show. It is dedicated to you, the listener, the consumer, the viewer, because a lot of you are viewing me on social media right now. The phone number is 877-943-9673. That's 877-943-9673. If you have a question, pick up the phones and give me a call. One more time, I'm going to give you that phone number, 877-943-9673. So a lot of you ask me, how important is it to have a routine eye examination, all right? So a routine eye exam is very important. It's one of the most important aspects of preventative medicine. So when you go to your local optometrist or you go to your local ophthalmologist, not only are they looking for the first signs of eye disease, but they are also looking for the first signs of systemic health problems. That's absolutely correct. The eye is the window to the body. So certainly we look for signs of glaucoma, macular degeneration, retinal holes, retinal tears, infections, inflammatory problems. But believe it or not, some of the first signs of pending strokes, brain tumors, even heart attacks, elevated cholesterol, elevated triglycerides, thyroid diseases, sexually transmitted diseases, collagen vascular diseases can show up in the eye. We had a caller on the first hour on some other radio stations just a few minutes ago talking about he had a Hollenhurst plaque in his eye and was relatively young and in good shape. Well, that eye doctor made an appropriate referral probably to the cardiologist, and I recommended the patient probably being on a baby aspirin a day combined with a good triglyceride form omega-3 fish oil. And so we do make recommendations. Remember, the recommendations that I make on here are for educational purposes only, and they never replace a comprehensive eye evaluation. So that's a disclaimer. They never replace a comprehensive eye evaluation. Also, first hour, we had a text come through on the computer or message. Somebody had gone to order on the Fortifeye website, and a warning came up about some kind of health warning. I got to tell you, that's only for California-based orders, and it's only for one product that we sell online from Douglas Laboratories. It is not any product at all that Fortifeye Vitamins has. And this is a kind of a strange law. If you don't get a stamp of approval and pay a regulatory association in California for your vitamins, they have to put that warning on their vitamins saying potentially you may have some heavy metals or lead or something like that in it. And so many companies don't want to pay the fee for that. And so they have to put that warning on it. It does not mean that the vitamins are contaminated, but it is not any Fortifeye Vitamins. All right, I do want to let everybody know we're running a special. It is a Black Friday special that we're going to be running at Fortifeye Vitamins. Listen up, write this down. It is the best special we've ever run on Fortifeye Vitamins. Remember, Fortifeye Vitamin Company, we have enzymes, we have probiotics, we have the most advanced, most potent omega-3 molecule on the market, Fortifeye Super Omega 3 Max. We have macular degeneration vitamins. We have a new pre-workout, post-workout supplement I developed that has no stimulants in it called Fortifeye Fit. It's amazing how well it works. We have a whey protein concentrate from New Zealand. I'm holding up a whey protein isolate from American grass-fed cows. We have a superfood that's organic, FODMAP-free, and gluten-free. So we got something for just about everybody. We have dry eye formulas. But here's the kicker. We're running a Black Friday amazing 40% off deal, Black Friday to Monday. So this is Thanksgiving weekend, post-weekend. All you got to do is use the promo code BLACK, all right? And you are going to get 40% off. I can't reiterate how good a deal this is because our products are not marked up that much to begin with, and then 40% off on that. You can start your New Year's resolution early today, get in that anti-aging zone. Remember, God made a pretty good body if we give it the right fuel. The problem is most of you that are buying stuff at the typical over-the-counter store that sells vitamins, you're not getting the right fuel. A lot of that is polluted with all sorts of nasty stuff: sucralose, aspartame, carrageenan, dyes, artificial flavors, synthetic vitamin E, binders and fillers that aren't good. The list goes on and on. Patients bring their vitamins in to see me all the time, a big bag of them, and I can tear almost every vitamin apart. Very rarely do I find one that I can really say wholeheartedly it's safe for you to take. So remember, anti-aging is a combination of many things. If I make your eyes healthier, I'm making your body healthier. If I make your body healthier, I'm making your eyes healthier. So it's a combination of exercise, all right, proper diet. I have developed a diet plan called the Lange Diet Plan. The average person, if they follow the plan, loses 6 pounds a week if they're overweight and they follow the plan. The plan also makes you drink plenty of water, exercise, and get sunshine. So it's not just diet. So the Lange Diet Plan, the proper diet, a Mediterranean diet, a paleo diet. I don't love keto and low-carb diets, and we'll talk about that more in a few minutes, and there's reasons for that. So once again, I'm pushing, before we take the next call, 40% off, use promo code BLACK, B-L-A-C-K for Black Friday. Go to fortifeye.com. That's Fortifeye, fortifeye.com. I have to plug this in so we can get the sound. All right, I try to do two things at once, and I think I can. All right, now we're ready to rock and roll. All right, phone lines are open, and I'm going to take the first call of the morning here on 860 930 a.m. Salem Media. Let's go to Judith. Judith, good morning.
Yes, good morning, Dr. Lang. Thanks for all you do. It's greatly appreciated. I wanted to ask you what your thoughts are on myasthenia gravis or ocular myasthenia gravis.
Aha. So myasthenia gravis is really something we call the great masquerader, okay? And it's a difficult diagnosis, and it can cause your doctors to go crazy, all right? Because sometimes you come in and you have one lid that's sagging. Other days you come in and have another lid that's sagging. Sometimes you have double vision. Sometimes you don't have double vision. And as you know, with this syndrome, you can feel tired and lethargic and things of this nature. And there's certain, we did a lot of oculoplastic procedures over the years, and we would always test for myasthenia gravis. There's blood tests and things you can do because we don't want to fix the lids. If all of a sudden you have myasthenia gravis and we fix the lids and then it goes away, then the lids are going to be way elevated and you're not going to be able to blink. So it is something that, your primary care physician probably isn't ideal at treating. A neurologist is probably a good person. Sometimes your internal medicine doctor can treat it as well. But it's the great masquerader for your eyes. Sometimes double vision, sometimes ptosis, sometimes your eyes are going to be drier and more irritated with this condition as well. Tell me what kind of symptoms you've been having.
And now what's a ptosis?
A ptosis is when your eyelid sags, okay? And it can sag into your line of sight. And the problem with this is oftentimes you'll come in and would think, oh, you got a brain tumor, right? You have an aneurysm. So you have a neurological problem. And oftentimes a lot of unnecessary testing can be done when they could test for MG first instead of doing a lot of unnecessary testing, MRAs and MRIs and CAT scans and, spinal punctures and things like this. So what kind of symptoms have you had?
Okay, well, I don't believe really the eyelid drooping. So just like with every other illness I have, I don't seem to fit the high-risk categories. I'm somewhat of an anomaly usually in terms of my other illnesses. But I have a lot of the non-eye issues.
Fatigue and muscle weakness?
Exactly. And ironically, I went to a rheumatologist recently, and she said, has anyone mentioned myasthenia gravis to you? And I said, no. And she said, well, you're one, and I think this may be the second time. They said the one side of your mouth seems to be drooping. And then when I went to an eye doctor recently, and actually I went to you a few years ago, I've been searching for answers as to why I have, I've been diagnosed with hypersomnia, which is really, once again, I'm not sure, I can't remember exactly how you termed it, but the great masquerader, that in its own right, too, can be so many different things. So I do have amblyopia. That could also cause, I don't have a lot of the double vision now, but it's like my eyes are just so tired. It's hard for me to keep my eyelids open. I have trouble breathing a lot of times.
Right.
One time a pulmonologist initially said, gosh, when he did a breathing test, he says, oh, it seems a little odd here. But then when he redid it, it seemed fine. So nothing's real obvious.
So has anybody,
so far.
Have they actually diagnosed you with myasthenia gravis? I mean, this is, in layman terms, it's a breakdown of the communication between the nerves and the muscles, okay? And if you have amblyopia, this is interesting because if you have amblyopia, that's a lazy eye, an eye that's not corrected to 20/20, you're oftentimes not going to get the double vision because in double vision, you got to have usually 20/20 in both eyes or good vision in both eyes. So that could be one reason you're not getting the double vision frequently. But those other symptoms could be related to that. And usually it's a droopy eyelid, and even your mouth can be a little droopy. Sometimes it almost looks like a Bell's palsy as well. And so they have to differentiate between a stroke, Bell's palsy, and myasthenia gravis, okay?
And actually, I have something that's considered a neurological issue, which is called limb movement disorder that happens through the night. And I've had over the years some very odd kinds of issues with, just some odd kinds of neurological, in terms of like my reaction time and things like that. So I was actually referred to a neurologist a little while ago because, too, with the different sleep disorders and such. But I haven't gone as of yet. But this thing with the eye doctor just came up, just about a week or so ago. So that's why I thought,
You can try something. We've done this years ago. Believe it or not, if you have a lid that's ptotic, that means ptosis. If one lid is sagging more than the other, take an ice pack. Put the ice pack on that eye. If it goes up, it's a good possibility you do have the myasthenia gravis. And there are injections that they can do also to actually help eliminate that. But you got to really find somebody that's in tune with that because, it is, I got to say, it's relatively rare.
Well, and that's why actually I'm very, very blessed that the eye doctor referred me to someone that he said is like the only one in the area, one of perhaps two,
right,
that would know about it. So he sent me to someone. So I feel in very capable hands.
Good.
That again, he said this doctor has been around forever and specializes in that kind of thing.
Right, because there are medications that can be used now. There are clinical studies. There's certain medications, anything from corticosteroids, immunosuppressants, and also I think it's called a cholinesterase inhibitor. These things can actually help possibly with the symptoms. But first thing is you got to get the right diagnosis.
Okay. Yeah, and I'm waiting. Actually, I have an appointment with this other doctor. He's based out of the University of South Florida, and I have an appointment with him. His first appointment was in January. So I'm, waiting on that. But as I said, I know you know so much about so much that I thought, oh my goodness.
Now the big issue here, Judith, you drive, right?
Well, that's a whole nother
All right.
story.
So anyway, if
yeah.
you are driving and you get double vision, you're going down the interstate and you see two exits, all right, always take the right exit, all right? If you know what I mean. But close one eye, or put a patch over your eye immediately because your double vision will go away. You always got to close one eye because you'll get very confused if you have double vision driving down the interstate. So remember that. If you get double vision, close one eye and you won't have double vision anymore, okay?
Well, I had surgery when I was young, when I was a child for the presbyopia, and it has pretty much just about cured it in many ways.
Good. All right.
So I'm very blessed with that.
It sounds like you're blessed to have a lot of competent physicians working with you, so keep it up and keep listening to the show.
Okay, I will. Thank you. Thanks for all you do and everything you do between your supplements and everything. It's all a blessing. Thank you.
Oh, thank you for the positive input. Bye-bye.
Bye-bye.
And that makes it all worthwhile. All right. You're listening to Ask the Doctor. I'm on some new stations this morning. Well, we broadcast last week on the station, so this is the second time on the station. We got about 15, 16 calls the first hour, but I got to warm you listeners up to call me. Here in Tampa Bay, 8:60 a.m., The Answer, and in Sarasota, 9:30 a.m. Once again, you're listening to Ask the Doctor. I'm your host, Dr. Michael Lange of the Lange Eye Institute and Fortifeye Vitamins. Pick up the phone, give me a call, no matter how simple or complicated your question is. I'll try to answer it to the best of my ability, and that is 877-943-9673. One more time, 877-943-9673. If I don't know the answer, I'll do the research and get back with you. I won't fake it. All right, last show, I was going to talk about something that I didn't talk about, so we're going to talk about this show because we probably got a lot of listeners on social media, especially from the last program. Omega-3. We talked in the last hour, we talked about omega-3, how it's important to be taking a triglyceride form omega-3 that has both EPA and DHA. I know a lot of doctors are prescribing a new drug out there that's just EPA. Well, fish have EPA and DHA in them, all right? They also have something called DPA in them. So I developed Fortifeye Super Omega close to 10 years ago. Went on a research trip to Norway with my wife, Tammy, and we developed, at the time, the most potent triglyceride molecule, omega-3. Then over the last 10 years, a couple of companies have come out with them that are a little bit more potent. So I developed Fortifeye Super Omega-3 Max recently. There is not anything on the market. There's not a krill, there's not a calamari, a squid oil, or a fish oil that is as potent as this in the triglyceride molecule. It has 1,200 EPA and 900 DHA per serving. That's a lot. All the new studies point to these elevated amounts of EPA and DHA combined being beneficial. Why do you take fish oil? Well, not only is it good for your skin and your joints and lowering inflammation in the body, but it could keep you above ground a little bit longer. Remember, the right form of fish oil. The lion's share of fish oil you buy over the counter has ethanol attached to it, and it is a useless amount of EPA and DHA. You have 180 EPA, 120 DHA. That's called 1812. And an ethyl ester molecule, it won't even move an omega index blood study. So once again, triglyceride form is going to absorb 3 times more readily than the ethyl ester form, and it is going to be very, very beneficial, all right? So there's some studies I talked about in the last hour where the DHA, not the EPA, but the DHA had a significant inverse association with coronary artery atherosclerosis. And your CAC score, that's a coronary artery calcification score, improves when you're taking high levels of DHA, all right? And so that's important, high levels of DHA. So Fortifeye Super Omega Max has 900 milligrams of DHA. Also, another study showed that you have an 18% reduced risk of coronary heart disease if you're taking a combination of EPA and DHA. So 18% reduced risk of coronary heart disease. And that's mostly in the high-risk populations. Those are patients that have elevated triglycerides, elevated cholesterol, especially the LDL, and even possibly elevated C-reactive proteins. So the omega-3 is very good for them. But something I didn't talk about, all of you athletes or anybody out there listening, listen to this. There's some new evidence that degenerative rotator cuff tears, so anybody's had a rotator cuff tear, you know it's painful and it's debilitating, is associated with low omega-3. So if you have low omega-3 on an omega index study, you're more susceptible to having a rotator cuff tear. So the study didn't prove that taking higher doses of omega-3 stopped this, but it makes sense. If you have low omega-3 and you're at a greater risk of degenerative rotator cuff tears, then maybe supplementing with a good omega-3 is going to be beneficial. All right, we're going to open up the phone lines. You're listening to Ask the Doctor. I'm your host, Dr. Michael Lange. You can go to a website, a new website. I race cars as well, so a lot of you like to stay in tune with some of the racing I do. But this website will actually link you up to my sponsors. It'll link you up to my social media. It'll link you up to my blog site. It'll link you up to my podcast and the radio shows and all of that. And you can watch some race videos too. So go to drmichaellangracing.com. So DR, don't spell doctor out, just drmichaellangracing.com. And then you can learn a lot more about what we have to offer. Now remember, the Black Friday special is using promo code BLACK, B-L-A-C-K. It's going from Friday until Monday. You go to Fortifeye.com. I'm going to spell that for you slowly. Fortifeye Vitamins is F-O-R-T-I-F-E-Y-E. Fortifeye.com. Put BLACK in the promo code at checkout. You're going to get 40% off the new Fortifeye Fit, any of the proteins, the superfoods, the omega-3s, the Super Omega. I would recommend the new Super Omega-3 Max. Anything that we make, you're going to get 40% off on that. Only on the Fortifeye Vitamins, so take advantage of that. All right, let me give you the phone lines. If you've got a question, give me a call at 877-943-9673. That's 877-943-9673. I hope everybody had a great Thanksgiving. I know I did. I took Mom down and visited my brother at a lake house that we still own in Picayune, Mississippi. We flew into New Orleans. I got to tell you, the NOLA airport is amazing. They just opened a new airport 2 weeks ago. Closed the old airport. It's right there in the same stomping grounds. It's amazing. I mean, it's a state-of-the-art, futuristic airport. You got to go see it. And make sure you have a praline or something while you're in there, some Cajun food, because a lot of good restaurants in there. But, you know, Thanksgiving, you got to start to think, what are you thankful for, all right? You got to find something that you're thankful for. Too many of us get depressed during the holiday season. You're thinking you don't have what you want. You're not as financially successful. You're fatter than you want to be. Socially, you're not in tune with what's going on. You know, you can't harp on the negativity in your life. Find something positive and harp on that, all right? You got to find something positive, because if you always think negative, it gets ingrained into your brain. It does. And then you got to see the psychiatrist. They put you on benzodiazepines to numb you out, to try to break that. And then the next thing you know, you're on tricyclic antidepressants and all of this stuff. So positive mindset. What can help that is cardiovascular exercise and omega-3. But you got to think positive. You can always find something happy, all right? Think about it, whether it's physical, mental, psychological, social, spiritually, financially. Go back and think about something that's good in your life. Think about that. Don't think about the negatives. Hope my brother's listening to this. All right, you're listening to Ask the Doctor. We're getting ready to take a break. I'm going to give you the phone lines, and then we're going to take a break. So the phone number is 877-943-9673. 877-943-9673. I'll be back in about 3 minutes. Stay tuned.
You're listening to Ask the Doctor with Dr. Michael Lange. The vitamins and supplements mentioned in this program are available at Fortifeye.com. That's Fortifeye.com.
It's hours a day spent in front of a computer screen or poring over documents and diagrams. Maybe as you get older, you struggle later in the day to focus on your favorite book. Whatever the reason that you find your eyes tired and that you struggle with eye fatigue, it's time to try Fortifeye Focus. Fortifeye Focus contains the powerful ingredient astaxanthin, a natural supplement discussed time and again among those in the eye care community as a powerful solution for fatigue due to eye strain and blue light exposure. Natural astaxanthin, the key ingredient in Fortifeye Focus, works at the mitochondrial level to support improved muscle endurance and recovery, helping to refresh your tired eyes and more fully enjoy all that you see. Order Fortifeye Focus today at fortifeye.com. That's FORTIFEYE.com. Or call 866-503-9746. 866-503-9746. 866-503-9746. And at fortifeye.com.
You've heard about the benefits of omega-3 fish oils. Study after study on the effect of omega-3s on everything from heart health to emotional well-being. Get the most out of your omega-3s with Fortifeye's Super Omega-3 Max, the most potent omega-3 supplement in the industry. Fortifeye's Super Omega-3 Max features one of the highest omega-3 fish oils available, purified and concentrated in a state-of-the-art facility in Norway, allowing for more EPA and DHA combined in the same size capsule. That means you get 50% more potency in every dose without increasing the dosage. Super Omega-3 Max is perfect for people striving to keep their hearts healthy and bodies operating at peak performance. Order Omega-3 Max today at fortifeye.com. That's FORTIFEYE.com. Or call 866-503-9746. That's 866-503-9746. 866-503-9746. And at fortifeye.com.
All righty. Good morning. Welcome back to Ask the Doctor. I'm your host. As usual, for close to 30 years, Dr. Michael Lange of the Lange Eye Institute and Fortifeye Vitamins. If you've got a question, pick up the phones and give me a call. Phone lines are open at 1-877-943-9673. If you're new to the program, who's Dr. Lange? Well, I'm a board-certified optometric physician, also a certified nutritional specialist. I've been hosting Ask the Doctor on multiple networks throughout the great country since April of 1993, not March, April of 1993. I used to have a drive time show here in Tampa Bay called Ask the Doctor. I was on every day, 9 to 10. Now we're on 9 to 11 on Saturdays, but every day, even Sunday. Sundays we did a tape at 1, but I was on 9 to 10 Monday through Saturday. So then I had to have a life. So I just broadcast on Saturdays, but we broadcast all over the place. So once again, if you have a question, it can be regarding nutritional intake, dietary changes, things of this nature, or an eye problem. The phone number is 1-877-943-9673. All right, so a lot of you are up north listening to this program, and you hear me talk a lot about vitamin D, all right? Vitamin D is very important. I mean, it is as important as omega-3. These are two things that most of us are deficient in, vitamin D3 and omega-3. Well, you heard me talking about omega-3. You take our Fortifeye Super Omega Max, your omega index is going to go through the roof. You're going to be healthier as a result of it, and we talked about 3 studies recently. Well, vitamin D3, if you're up north, you can't get sunshine. Here in Florida, most of us aren't D3 deficient if we're going out in the sun without sunscreen for 30 to 40 minutes. So I do recommend sunshine. If you're up north, you have to go in between 2 buildings when the sun's shining where there's not any wind, maybe get some sunshine. But you can supplement with vitamin D3. And you can take 2,000 units of vitamin D3 without a problem. 5,000 units is okay if you're big, all right? If you're darkly pigmented and you weigh over 250, 300 pounds, 5,000 IUs is fine. Oftentimes, doctors will put you on 5,000 units to start out with, but I found if you are fair-complected, light eyes, then you don't need to be taking that much vitamin D3. Remember, too much vitamin D3, this is a fat-soluble vitamin, can actually do just the opposite and make brittle bones or trigger atrial fibrillation, which nobody wants, right? So more is not necessarily better. Have a 25 hydroxy test done. That's a blood test for vitamin D3. Your levels should be above 60 to be in that anti-aging zone. Some doctors even say above 80. Most people, they're going to be around 20 or 30. That's too low. So supplementing with vitamin D3 supplements and getting sunshine. All right, we are finally loading up with some phone calls. Let's go to the first caller, Chris. Let's see. Chris is on line 2. Chris, thanks for holding. Good morning.
Hey, good morning, doctor. How you doing?
Very good. And yourself?
Yeah, not too bad. I had a question for you. I just turned 40, and I've noticed that I've been having lots of eye strain. And, I work on a computer 8 straight hours a day.
Right.
What kind of advice do you have for me?
Perfect question. So at 40, you're going through a stage in your life called presbyopia. It sounds pretty nasty. Presbyopia just means you hit 40, you're starting to lose the ability to focus up close. It happens to everybody between 38 and 42 years of age, okay? So presbyopia is when the human crystalline lens in your eye loses its elasticity, and the ciliary muscles responsible for changing the shape of this lens to focus the light on your retina is not happening the way it used to. And your arms aren't long enough anymore. You keep pushing your arms out further and further, and ultimately you end up getting reading glasses. Well, I'm 58 now, and I still don't wear reading glasses. When I was 50, I did wear reading glasses. I developed a product called Fortifeye Focus that's going to help you dramatically. But before we talk about it, let's talk about a natural way, just eating specific foods. Wild Alaskan salmon, it's got to be wild salmon. It can't be farm caught. Farm-raised salmon is the death of you. Stay away from anything that's farm-raised fish. But farm-raised salmon is the worst. So wild Alaskan salmon, it can be canned, it can be frozen, it can even be smoked and ultimately fresh. Wild Alaskan salmon is high in a nutrient called astaxanthin. Astaxanthin is what gives these salmon the ability to swim upstream. It improves their muscle endurance and their muscle recovery, and therefore it helps your muscle endurance and muscle recovery, and it targets the ciliary muscles in your eye. It actually crosses the blood-retinal barrier, gets into the retina as well. So it's an anti-aging nutrient for the eye and the body. So eat more wild Alaskan salmon. Then throw some organic kale, not spinach. I used to promote spinach, but spinach are very high in oxalates, and we don't want to cause kidney stones. But organic kale and organic orange bell peppers, saute it all in a little coconut oil, and then take an egg and put it on the top. And the reason for the egg, it's got to be a free-range organic egg. The egg has phospholipids in the yolk that make the lutein from the kale, the zeaxanthin from the orange bell peppers, and the astaxanthin from wild Alaskan salmon go right into your retina, protecting your retina against blue light damage from the computer, because you're on a computer a lot. The blue light emitted from the computer is damaging to your eye. And so that's a food that you can do that will slow down the degenerative effects in your eye, help prevent macular degeneration, improve your focusing ability. But let's face it, some people hate wild Alaskan salmon, kale, and orange bell peppers. So everybody's not going to do that on a daily basis. So I developed a little pill, Chris, called Fortifeye Focus. And Focus is a little gel cap of fish gelatin. It has olive oil as the delivery system, and it has high amounts of lutein, zeaxanthin, and the astaxanthin. I recommend everybody from 10 years of age to 100 taking this pill, especially if you're on a computer a lot. It's going to eliminate your computer fatigue dramatically. It's going to protect your eyes from the blue light by increasing something called macular pigment density, okay? And it's very good for every cell in your body. It actually supports mitochondria and improves energy levels without any hype the way caffeine can. So eat the foods we talked about. Consider taking Fortifeye Focus. Get the Black Friday special. Use BLACK as the promo code. You're going to get 40% off. And then you got to keep me posted on this, because what I want to do, if you're a caller 10 years from now, I want you to tell me, Doc, I still don't need reading glasses, and now I'm 50 years of age.
Excellent. Well, thank you, doctor.
All right, Chris, thanks for the call. Have a great day. All right.
You too. Bye-bye.
We got a lot of great callers. We are getting loaded up now. I see we have some more. The phone calls are starting to ring again. We're going to take Betty first, then we're going to take Dr. Hall. But we're going to go to Betty in Clearwater. Betty, thanks for holding. Good morning.
Good morning. I wondered, my husband and I had called in before, and you told him to take the Fortifeye Eye Macular Defense and the Fortifeye Eye Focus, and it's made a big difference in his eyesight. He just knew almost, he said within a week or so, how well he was doing on it.
Outstanding.
So that's good news. But there's one problem that he's been having lately, and he mentioned he is having a problem with depth perception when he drives. You know, the distance between stopping where the car is in front of him.
Right.
And that's kind of new.
Okay, so depth perception. How old is your husband?
He's 82.
He's still a young, spry character. Okay.
Yes, he is, I'll show you.
So at 82, has he had cataract surgery yet?
No.
Chances are, if I look at my crystal ball right now, I see cataracts in his eye, right? I've never looked at an 82-year-old not seeing a cataract. And so what happens with cataracts when you're driving, it can cause a dispersion of light, glare, all right? That glare in the sunshine or driving at night can reduce your acuity and reduce your depth perception. Also, if he checks his vision, one eye might be clearer than the other eye, okay? And you can ask him that when you get off the show. Just say, is one eye clear in the other eye? That's a discrepancy as well. That decreases your depth perception. So remember, if you have really bad, one eye is really bad, you won't have any depth perception. That could be related to a cataract. It could be related to a refractive change in his spectacles. It could be related to a disease, like macular degeneration. So taking the right supplements, the Fortifeye Macular Defense combined with the Fortifeye Focus is going to be beneficial from a nutritional standpoint. Seeing his optometrist and or ophthalmologist per their instructions and having a refraction done to see what his best corrected vision is. And I always tell patients, when your doctor tells you this is the best you can see with your glasses, I can't make you see any better, then when you're not happy with that, that's when you need to have the cataracts removed. Remember, cataract surgery is about 10 minutes, topical anesthesia. You don't put you to sleep. And so I bet you he's developing a cataract, and it might be getting close to the time to remove the cataract because he's aware of the symptomology. He's aware his depth perception's off. That's one of the first symptoms with cataracts.
Oh, that in a way is good news. It's bad news, but good news.
No,
because,
absolutely.
Heck, sure.
Cataracts can be corrected. We're blessed to have a lot of great cataract surgeons in the area. So it's a relatively simple, not to underestimate the power of cataract surgery, but it's a relatively simple procedure. It's about a 10-minute procedure in the hands of a competent surgeon, and the results are amazing. Now,
what you mentioned, it's surprising in a way because what got us back to the eye doctor for an eye checkup is a year ago he had a prescription for new glasses and he got them, but then recently the one prescription on the one side was completely different, and we had to go get that lens changed. So that's what got us into thinking possibly, he had macular degeneration getting started or something, but they said no, they didn't think so, but they're going to keep checking it.
Right. At 82, it's not uncommon to have macular degeneration, dry eye, and cataracts. So he can use lubricating eye drops and see if that helps, all right? You can buy on our website. We have we have Oasis Tears Plus. That's my favorite. We have Fresh Coat, and we have Blink. Those are lubricants you can't buy over the counter, and they work very good. So lubrication is very important. Continue the vitamins. And then, maybe talk to your doctor about cataracts and see if it's time to have the cataracts removed.
I think you're right on track with that.
My crystal ball isn't off that often.
Well, that one sounds good. But I really wanted to tell you, if anybody's leery about taking some of those other vitamins, when she was wondering if he had the macular degeneration, she did 4 eye scans, and she couldn't determine exactly for sure that he had it or not. But we're watching it, but he's been fine since he had the checkup. But I think also these vitamins are helping.
Well, remember, a lot of times we're nutrient compromised in the nutrients that feed the retina. And so these vitamins that I've developed actually do feed the retina. They're not miracle pills, but I got to tell you, I see miracles happen every day in my practice. When we adjust the patient's diet, we get them on the right supplements, get them off the garbage that they've been taking, and, talk to them about things to be proactive in their overall health and their ocular health. I see people improve all the time. I see people that have not legal driving vision. They've lost their driver's license 5-6 years ago, and they regain their ability to drive because their vision improves that much. So it is something that does happen.
Okay, but keep up the good work because it really has been helping.
Thanks for the call. I appreciate it.
All right. Thank you so much.
Bye-bye. All right, you're listening to Ask the Doctor. You can follow me on a variety of social media like all of you are right now. You can follow me on Periscope, LinkedIn, Twitter, Pinterest, Facebook, Instagram, a variety of places you can follow me on social media. I give promo codes every now and then. No promo code like this one for Black Friday, which is 40% off. Remember, I see patients at the Lange Eye Institute in the Villages Monday through Friday. Doc Hall is at the Lange Nutrition Center in Ocala. It's upstairs in our building right across from the mall. That's 3101 Southwest College Road. Only two-story building on State Road 200. It's a mile off the interstate. And upstairs, you go up the elevator, Lange Nutrition Center, Fortifeye Distribution Headquarters. Doc Hall is a PhD in clinical nutrition. He's also an icon in the bodybuilding industry and in the sports nutrition industry and the powerlifting industry. He's been a pro judge. He's been a bodybuilder. He's been the director of bodybuilding associations. He owned the first Gold's Gym in Florida. He owned the largest health and wellness center in the state of Florida. And Doc Hall is an asset. He is the asset on my team. Anyway, I think Doc Hall is on hold, but first let me give you the phone numbers one more time. Give me a call if you got a question, 877-943-9673. Also, if you're watching me on social media, I'm holding up a superfood that I developed called Praline Crunch. Paleo Simplified Praline Crunch. Everybody at the radio studio loves this, and thousands of you worldwide are taking it. This is a healthy snack. It's low carbohydrate, low sugar, gluten-free, and oat-free. A lot of you didn't know that. Oats are not the best food for you to take because oats are high in glyphosates, Roundup, and oats are also high in dietary phytates that block the absorption of nutrients. So I would say no to my oatmeal. If you absolutely have to have oatmeal in the morning, then buy organic sprouted oats, organic oatmeal, soak it overnight in water, take a shot of apple cider vinegar to soak it in there. That helps reduce the dietary phytates. If it's organic, hopefully it doesn't have the glyphosates in it. Also, you got to stay away from rice because of the arsenic. All right, let's see what Doc Hall has to say. He's been waiting patiently. Doc Hall, good morning.
Good morning and happy holidays to my good friend and colleague. Missed being on the show this morning, but I do thank all the listeners that have contacted me and said, Doc, when you're coming back, and we're trying to make that happen. And it's just a little trip to go from Ocala over to Tampa, but I like going over and being with my good friend and his family and doing the show. So I'll be back. Hopefully next week I'll be making my trip over that way, and we'll start doing it on a regular basis. But I have a whole list of things. I found out today that I can actually write as fast as I can talk sometimes, and so I made a whole list of things that you have talked about this morning. And I did want to interject this, that you talked earlier about plant sterols, and we do have a product in the Lange Eye Institute and at the Lange Nutrition Center. It's called Cardio Guard, and it's loaded with plant sterols. Now, folks, these are sterols, not steroids, and there's a big difference. They're natural, and so it's an all-in-one type thing. And if you need more information, just give me a call at the Nutrition Center, and it'll go right to my office. And I have a couple other new things that we're going to do. I'm going to leak a little bit of information here for the holidays. We have I bought a bunch of gift bags for the Nutrition Center, and we're going to do a little special promo up there. But I'm all about everyone, all your listeners and our listeners, I should say, of buying our products and being healthy and getting on a good nutrition program and like that. But I want your friends and your family and your loved ones and maybe your workout partner or your personal trainer to get on that program too. And the best gift that you can give them is give them the gift of health.
Amen.
And I want to promote that this season. And so what we're going to do is this. You come into the Lange Nutrition Center and in Ocala, and I'm going to try to do this down in the villages too, if we can make this happen too. But you come in and say, Doc, I want to give the gift of health this year. I'm going to give you a free gift bag, and they're customized bags. They're really cool, and you can fill it up with what you want for your loved one, your your wife, your postman, for whoever. And we have not just vitamins and like that, but we have snacks in there too that are great for the holidays. And so just come in. There's no charge. It's free. It's my gift to you. And come in and just say, Doc, I need a gift bag, and we're going to give you one. And that's why supplies last. They're very limited, but they're really cool, and I think it's a way of showing someone that you really care. I'm going to blast something out here that even Dr. Lange hasn't even announced yet, so I'm going to steal his thunder a little bit. Mm-hmm. And we're coming out with a new clothing line, and our first product out is going to be a really nice T-shirt promoting our performance line, and it comes in black, and it's going to be available here. I hope before Christmas. We're trying to, but this isn't your run-of-the-mill T-shirt. This is something really nice. So I just wanted to get that out there a little bit and let folks know that we've got good things coming. And I wanted to say, too, that now is the best time. I get this call every single day, folks. They call up the office. They go, Doc, when's the best time I should start my diet? Should I wait till after the holidays? Or no, today's the best day. Mm-hmm. Today is the best day. And I don't call it a diet. I like a nutrition plan. I like a lifestyle plan. Start it today. Don't wait till after the new year, okay? If you can taper back now just a little bit, go ahead and eat those holiday foods. I know you're going to anyway. And the old thing is eat, drink, and be merry, and call me after the first of the year. Well, I want you to call me now. Let's not wait till after the first of the year. And that's our country is overfed and undernourished, and now's the time to correct that. Don't wait till the first of the year. And but that's all I have. And I did get some calls today too, and some text about Yellow Submarine that you made comments about in the first segment, and I appreciate that. And but Dr. Lange and I have some journeys that we're going to be on in January and February. We're headed back out to the coast again to two big events out there, so we'll have new information and updates on all the world of nutrition and sports medicine and like that, and that's coming to you. But anyway, that's all I had for today.
Doc,
great.
Hold on. Since I got you on, since you're an icon in the sports nutrition industry, right now I'm holding up the new Fortifeye Fit that I developed, and you helped me on this project. We worked on it for 2 years. But if you could just expand briefly in about 2 minutes about Fortifeye Fit, about how most of these people that are going to the gym, they're buying these pre-workout supplements that are just jacked with lots of caffeine and beta-alanine, maybe not the best thing in the world for them, and how we've developed something that's clean, that is used for pre-workout and post-workout for anybody at any age.
Well, it's about 2 years ago. Of course, you and I have been friends, and we've known each other for many, many years. And but we got our heads together a couple of years ago, and we were both concerned just about these pre-workouts. Plus, there's a race on with these companies right now, these manufacturers, so-called vitamin manufacturers and health manufacturers, to create the most outrageous pre-workout that's loaded with caffeine and stimulants and like that. And I've seen people come in that their heart is racing. I can see their heart beating through their clothes. Folks, this isn't healthy. This isn't a good thing. Pre-workouts do not contribute. The ones that are out there on the market do not contribute in any way, shape, or form to your health or anything. In fact, they can take away from that. Dr. Lange and I were both concerned about that, and that's what drove us to bring out and formulate the new Fortifeye Fit. And it's just loaded with all kinds of good things. And what I found in my research over the years is this: that there's two parts, folks, of your workout and your exercise regimen. It's the actual physical part, that's stage one. Stage two is your recovery. In my research, I found 60% and greater of people that work out don't know about recovery, or they don't practice it. They have no protocol for recovery. And if I ask them, they go, "Oh, Doc, I'm fine with my recovery. I drink a bottle of water and I sit down for a while." And I always go, "Yeah, and then what?" And there's nothing else. Well, I eat dinner later, I eat something, and there's an actual window there that you have to hit with nutrients, because your body at that time, you put it through an extreme process for the exercise, and it's begging for nutrition at that point. But you have to hit it at a certain window. And ours are just loaded with the very things. You and I have researched this bad boy for 2 years, and we've talked to pro athletes and pro teams, and I mean, the top of the top we've talked to got their input, and then, of course, we actually did the clinical research on it to back up all those things. We have the studies. We have the research. We have all those things. And we put this together.
There's the music. We got to roll, buddy.
Oh, my God.
Thank you for being thank you for calling in, Doc.
Okay, guys. Thank you. Happy holidays.
Thank you. And I want to wish everybody a happy, healthy holiday season. Remember, black is the promo code. Check out Fortifeye Fit. Get 40% off at Fortifeye.com until Monday. Thanks for tuning in, listening to Ask the Doctor. I'm your host, as usual, Dr. Michael Lang. I'll be back next week for another 2 hours of Ask the Doctor. I'm out of here. Have a great day, and God.